and I'll give you the key. It's easy. Just keep on hopping, keep on rocking, and don't start stopping. It's everything you need just to walk the scene. And if you wanna make it big, you give it to me, I'll grease it. I believe for you, you wouldn't believe what I see in you. So don't stop, don't let the dream drop off. Hold up and make it lovely, make it real, and make it yours. Don't stop.
All right, Dr. Nick, welcome to the show. We were talking off camera, and so it was
Right.
like, okay, we should just turn this on because this is good stuff. So just a little recap. So last weekend was my first powerlifting meet in 16 months. I was
Bless
coming
you.
back from a huge injury. If anybody follows the podcast, they know that this was like a huge thing because I had a brachial plexus injury and I had no arm for a long time. So anyway, we were talking about I have nearly no voice because I was screaming for all of my friends, and then how loud the dang room gets when you step up to the bar. So the meet director literally told me, she was like, when you stepped up to the bar, the room every time was just so loud. And so I stepped up for the 500 squat, and it was so loud I actually was trying to mentally tune it out so that I
Shoot it out,
could
yeah.
so that I could hear my coach who was standing behind me. And then my buddy Heinz came to hand off for me for bench and back spot and stuff. And he was behind me and he's yelling in my ear like a drill sergeant, like, today's your day. It's time to eat.
Right.
Let's go,
Right.
and the crowd is so loud and you're just trying to focus on your squat and like, the energy is insane. It's like the craziest energy ever.
Yeah. Yeah, no, I love that. I think that's so necessary. I remember even before med school, like being a kid, being a teenager, and hearing all these stories about like, oh, I don't know, a mother, getting her car stuck on the train track and her kid is inside and she needs to like, and you basically times when you need to have this like superhuman strength. And I've heard these stories ever since I was a kid, of very very specific circumstances where people need to essentially display superhuman strength or they lose a loved one, and more often than not they can demonstrate that strength and get their loved one out of that situation. And I think about that right now as you tell me this, right? Because you have to ask yourself, like, what is going, like when you're when your friends in your ear like a drill sergeant, the crowd is going insane, all the energy from a physiological standpoint, there is a response, right? I'll
Mhm.
bet you all of your stress hormones, right? Your cortisol, your norepinephrine, all the stress hormones just go up, just go up, out. What did they say? Out of the roof? No,
Yeah,
up.
through the roof.
What am I saying? Through the roof. Thank you. That's what I meant to say. They go through the roof, and I obviously that's going to have from a strength standpoint, from a muscular tension standpoint, that's going to have an effect that's going to be palpable. Because here's the thing, like I have only ever back squatted 505 one time, and I'll tell you what, Connie. For me, the thing that gets me going, because like I didn't do this at a competition. I just did this. There was one day at CrossFit, and it was test your one rep max day, and I remember I just wanted a PR. I wanted a personal record. That day, Connie, and every day since then that I've ever needed a personal record, I have to have one specific song in my ear. I have to have these guys in my ear, right? The AirPods Pro, because then I'll turn on the silence mode. So like it's just a cone of silence. And then I will put on Linkin Park Faint. And then I will wait for the crescendo, and then just before the crescendo, I'm like, it's time to lift. Let's go. So
Yeah.
that day, I squatted a 505. Like if you tell me today, like, yeah, Nick, go back squat, even like let's say 50 pounds of left, probably like 405, 420, I could do without an issue. But like even 50 pounds less at 450, I'm gonna be like, oh, that's a lot of weight. I don't know. But yeah,
Mhm.
you give me enough coffee, right? You give me enough Lincoln Park. I'm gonna lift that at 505. And I just love that, like you get to experience that in the competition setting. And then like I said, it just makes me think about these hair-raising circumstances and so many people who are not like you and I who do not, because the difference with you and I is like as compared to the normal population is we consistently put our body to that near 100% stress. And
Mhm.
most people don't, right? So, you know, if somebody were to ask me to do something just out and about that requires a lot of strength, I know my numbers. All we all have our numbers memorized. We know our numbers, but I
Mhm.
think that for the common man or common woman who is having their family member in a situation of duress and they, you know, they need to help them, otherwise that person dies. I think that's it speaks to the power of our physiology. It speaks to the mind muscle connection, and you know, the fact that we are so much more than we seem to be.
Well, and it's funny you bring that up because I had Justin Jacoby on the podcast a while back, and he said when he trains, he said this might sound terrible, but he literally pictures somebody in a life or death situation, and if
Let's go.
he doesn't get that
Yeah,
last rep in, they're gonna die, you know. Like, and he's
yeah,
like, might
yeah.
sound gruesome. He's like, but that's the level you got to take it to. But that's also
Yes.
why deloads and recovery periods and things like that are so important, and people don't understand it. Like, I was talking to my dad and I was like, well, my CNS is fried this week, so I'm taking a week off. And he was like, well, why? And I'm like, well, because I'm putting my system under max stress levels, so everything else in my life has to be low key. So if I have stress going on with my job and I'm not eating enough, and I got family stress, and I'm doing cardio, which you do cardio, I do a lot less cardio than you do, but you know, I'm putting my body under these max stressful conditions. I have to give it time to recover. So that doesn't look like training for 6 days a week for me. That looks much different, and I have to be respectful to my body. Like, I just got done with this meet. It was the hardest I've ever had to push it for a long time. That means it's going to take me at least 6 weeks to recover. And people don't realize that. They're like, oh, well, because I didn't get the numbers I needed that I was looking for at this meet. And they were like, well, you could do another meet. And I'm like, well, you don't understand. It's going to take me at least preferably 8 weeks of taking things down a huge piece and letting my system recover, because it's been working so hard for me for so long. So it would be unhealthy and irresponsible of me to turn around and start pushing when my body's not ready.
Yeah, no, I totally agree with that. I think that I don't know how you feel, Tommy, about kind of our strength, uh the average strength of a human being as they age, the average muscle mass of a human being as they age, right? So sarcopenia, which I'm sure you know what that is, and if you
Mm-hmm.
don't, we can talk about it. Sarcopenia and dynapenia are two real things, right? Sarcopenia, the age-related loss of muscle; dynapenia, the age-related loss of strength. However, you know, even though those are two physiological realities, I think that another reality that I try to tell people, because I'm sorry for cursing, but I'm going to do it. I hate the bullshit. I hate the mindset, the bullshit mindset that people have that, oh, well, you know, I'm getting older, so I should be less active, or I'm getting older, so I should pull back. And usually when I hear that nonsense, if I care enough about the person, if I don't care, if the person, if I don't know the person, listen, I have no right to try to get in there and tweak their mindset and change their mindset for the better. So I'm just going to shut up. But if I care about the person, I'm going to kind of, you know, invoke, or rather talk to them and push a different mindset. And the mindset that I push when I hear, you know, this nonsense about, oh, I'm getting too old and I should be less active, the mindset, or the argument that I push is, hey, listen, as we get older, we can actually maintain our strength. We can actually get stronger. What I do absolutely agree with that goes away with age is recovery ability,
Mm.
recovery capacity. How quickly can you recover? The quintessential example of that are our livers. So there is an entire enzymatic system within the liver called the CYP450 system. And the CYP450 system is part of the reason why when you're 18, 19, 20, 21, you can drink with the best of them, right? And you can recover. And the next day you can wake up 7 a.m. I'm fine. Go about your day and be completely fine, because those enzymes are at a not just a capacity but an efficacy. They have uh you know, a degree of efficiency and a degree of capacity to do work that is simply not that simply does not hold for the rest of our lives. So when you consider that fact, and that's just a very simple kind of example I can give you about something that pretty much all of us have experience with, the fact that we're not able to tolerate alcohol as much as we did when we were younger. The same thing is present with the rest of the body, in so much that, you know, we have to be more mindful and take more care and be more conscientious and be more purposeful with recovery. And
Mm-hmm.
when we are not, we're basically asking for injury. We're asking to break down. And what I'm about to say, I'm sure the same can be said for you, but I know my numbers from a 1 minute mile to a 1 rep max back squat to a 1 rep max deadlift to a bench press to a clean and jerk to a snatch to a maximum pull up, maximum strict pull ups. To I know my numbers to the extent that I can absolutely say that today, here and now, at 40 years old. So I hit 40 December 5th, 2023. So here and now, at 40 years old, I know my numbers enough to tell you with full confidence that I am better from a functional standpoint now across the board with all of my numbers than I have ever been in my life. However, in as much as that's the truth, I can also say that I can't recover like I used to 10 years ago or 15 years ago. So this is why I love the fact that you told your dad what you told him. And to be honest, it speaks to your experience and your know-how of the game here, which is that, yeah, you can crush people 10, 15, 20 years younger than you in strength. But the thing that you cannot beat them at, well, actually, I guess steroids. I keep hearing that. I guess steroids give you immense recovery capacity. But
Mm-hmm.
assuming that we're completely natural, hell, I didn't even think about the steroids thing until the
Mm-hmm.
words are about to come out of my mouth. But assuming that we're completely natural and there are no other agents at play, our recovery capacity goes down. So how do
Mm-hmm.
we battle against that and still make progress? We just have to. I'm a huge. You probably know this, Connie, from following me on Insta, but I'm a huge data nerd. I just love
Yeah.
numbers. So if you give me the data as it pertains to my body and the things to track, then I know exactly where I am from a recovery standpoint. And there will be days where I'll wake up like, cool, I'm gonna go, or no, it won't be days. It will be the previous night where I will go to bed thinking, oh, I'm gonna go to the gym tomorrow, and then I wake up and I look at my recovery metrics and I also feel myself, right? I take a subjective assessment and I'm like, nope, I'm not going to the gym today, right? Because I know that if I do go to the gym today, it's not that I can't perform, it's that the risk of injury is so much higher.
Yes.
And, this game long term, whether you're competing with others or you're simply competing with yourself and you want to turn into the best version of yourself, this game long term is won by consistency.
Mm-hmm.
So if you're getting injured and now you need to take out 3 to 6 months or however long that it takes you to recover, as you have recently come back from, right, and
Yeah.
crushed it and coming back. But just imagine where you would have been if you didn't have the brachial plexus injury and you could have trained all through that duration. Yeah, I mean, you would have been you're amazing as it is right now, but you would have been amazing plus, right? A little bit more amazing. So
Yeah, well, that's kind of funny though, because I feel like, and this was an interesting thing. So, how many people allow a setback to put them behind? I think my setback actually put me ahead, as funny as that sounds, because what happened is it forced me to do all of the little things that I never do,
sure,
right? So,
sure.
we started doing 6-second eccentrics, we started doing timed loading, we started going beyond range of motion and loading that
Mhm.
tissue. We started doing all these things. And so now, I mean, I put insane, aside from I had never back squatted in competition before because I had reconstructive hip surgery in 2020. I used to race motorcycles at an elite level, so I've had 15 orthopedic surgeries. But anyway, but it forced me to actually do things much differently. And when all of that started to all of the sudden manifest, I started putting some insane strength on because I could recruit from multiple different levels. So
Mhm.
it actually may have helped me. I would be curious
Mm.
how things actually would work if you ran a side by side experiment, but it
Mhm.
actually helped me a ton. And it was really crazy. So, reversing to what we were talking about with recovery, there's another piece we have to factor in with this. And I think that's as you get really good at working out and connecting with your muscle groups, like, so when you're younger, you're not as good at connecting with things. You're just more or less going through the motions, right? You're learning, your system is learning, it's learning how to recruit tissue better. As you're in the game longer, you become very good at recruiting at your systems, and so does your CNS. So you
Absolutely.
can do much more damage. When you used to have to go in 6 days a week and push, you were doing an equal amount of damage as you are going in 3 days a week, because your ability to recruit the muscle fibers with less volume, I guess I would say, or
Mhm.
less
Mhm.
exercises is much higher.
Mhm.
So 3
Mhm.
days a week may be equal to what you did 6 days a week when you were younger, or when you first started your fitness journey, because your nervous
Mhm.
system has now mastered recruitment. So that
Yep.
is also much harder to recover from when you are
Yes.
utilizing every fiber of the tissue. So
Sure.
that's where we get into all of these nuances with having to
Mhm.
recover and it taking longer to recover, and being understanding of that. I mean, some days you may feel great, but your nervous, you might not be sore, your muscles are good, but maybe your nervous system needs a second because it just used everything it had to make that
Mhm.
max effort day happen.
Yep. No, I love that. I love that insight. That's totally. To be honest, I've never thought of that, and there is nothing I can think of from my understanding of human biology, physiology, and anatomy that pushes back against that. I mean, essentially, somebody like you, if you look at recruitment, and you can judge that in any number of ways, right? But if you look at muscular recruitment, you are recruiting so many more of your muscle fibers, right? Many more type 1 and type 2 fibers during any given lift than somebody who's a beginner or somebody who's even a novice, right? Because
Hmm.
you train that, and
Hmm.
I mean that's a great thing. But yeah, I think that because of that, you could essentially get by with doing less days and still have those days be as effective from a muscle stimulus and a progressive overload standpoint, right?
Hmm.
Just because of your ability to generate tension. And it's funny, this kind of makes me, I think you just answered a question that I had in the gym yesterday. So I did so yesterday at the gym we were doing strict press, right? And we it was like a 4 rep max strict press. It wasn't a max, it wasn't a max. It was just another training day in the cycle. But I strict pressed 185 for 4, and somebody at the gym was like, "Oh, dude, that's so heavy. How can you do that?" And I immediately shut them down by I was like, "No." I was like, first of all, thank you, but no, that's not impressive. I was like, "You want to see real impressive?" So I pull out my phone and I go to this guy's Instagram page, Connie, who you should check out. His name is Wall Street Weightlifter. So he's a good friend of mine. I mean, we just met a couple of weekends ago at the CrossFit for Health Summit. This guy on his Instagram, he's strict pressing 335 for 3 reps. So what the hell is my 185 for 4 reps? And then the guy at my gym that I showed this to yesterday when he was impressed by my 185, then like, and I've noticed some human beings will do this. Then he was like, well, oh, he's juicing, he's taking something, and that's always been my pet peeve. Like I've noticed human beings do this whenever like somebody else is at a better place than they are in life in any aspect. They
Make an
because we
excuse.
only know exactly because we know the efforts that we put in. I know how much I bust my ass in the gym. I don't know if Connie's doing 100%. So if I see Connie beating me, I'm just going to be like, cheater, because I know that I put in 100%. So if
Hmm.
she's beating me, then she has to be cheating, or she could be doing more effective workouts than you. She could
Hmm.
be using her brain and understanding the anatomy, the biology, the physiology. She could be understanding nuances that you don't understand and applying them. Anyway, I'm getting aside on this story. The point of me bringing up this story is that after I dismissed my friend's, excuse, or not, or him trying to give the guy an excuse of, oh well, he's cheating. I told him,
Hmm.
I was like, no, I was like, he's not cheating. I refuse to believe that, because I've talked to this guy. I know him. I know his work ethic. I think
Hmm.
instead, what it is with him is that before he started CrossFit, he was a strongman competitor,
Yeah, and that's
and
the bread and butter of their training.
telling you,
Yeah.
these strongman competitors, and okay, so then I guess the next question is, okay, well, why is it that these strongman competitors can come into CrossFit and do a couple rep, 3 rep, 4 rep max strict press with us and just embarrass us? And in my mind, the explanation is literally, that's what I said. What you said just helped me connect the dots. The reason why he embarrasses me with his strict press is because even though he's smaller than me, and I'm taller than him, I'm bigger than him, he essentially recruits so many more muscle fibers from his training as compared to me, right? And I think that's the game, right? That's the game is okay, well, if that's the case, then the next question is, how do I recruit more muscle fibers, right? How do I make this happen with time? So yeah, that's
Well,
awesome. Yeah.
and it's so funny. So immediately when towards the end of my prep, I started to get not, it's funny because when you start using your nervous system to the full extent, all of a sudden it's like, dang, I'm a little dumber. Like this is
Yeah.
affecting my brain power. And
Sure.
so okay, so what can I do to work on this? Because if I'm a little dumber, I'm obviously not going to be recruiting things because I'm sitting there after a max effort day and I'm like, wow, what was I trying to say? Like it's like gone, I
Yeah.
mean,
Yeah.
I'm
Yeah. Yeah.
like, but I can't talk. Like I'm trying to have
Sure.
an educated conversation and it's sitting there and it won't come out. And so then all of a sudden
Right.
I'm like, oh my gosh, I got to do something here. So then, getting into the woo woo things, what can you start nitpicking at to manage your ability to be the best at what you have? And this goes back to the people that make excuses, right? But they don't realize all these little things that are bringing into play. Like, so I was getting made fun of because so the first thing I did is I was like, okay, well, I need my brain to work better. So I need some choline. I ordered the Alpha Brain Black Label. I was like, crap, I'll try it. What's it gonna hurt? Ordered that. Ordered L-theanine and GABA, all these things, and I started
Nice.
loading on all of these things that are really good for your neuroplasticity so that hopefully my brain would work better, so that it would tell my muscles to work better. Like, talk about trying to nitpick and get any little edge that you can on something so that you can perform at what you want to do. And so I think a lot of people don't realize that. They think it's just going to the gym, going through the motions, and then steroids. People think that's the game changer, which honestly I work
Yeah. Yeah.
with.
Yeah.
I'm in all facets of these sports, right? I work with people that are enhanced, I work with people that are not enhanced, and they're all working just as hard, right? But the thing is it's how many things do you have to put into your bucket to make what you need to happen? And for some of these people, it's everything. Like, I mean, it's their day-to-day habits, it's their mindset. They sit down and meditate to give their brain a bit break. They're checking the sleep boxes, they're checking the nutrition boxes. Every single box is getting checked in order to make these things happen. Whereas that person that thinks that your buddy is juicing or whatever, they don't realize he's tracking his sleep, he's tracking his recovery, he's counting his calories, he's making sure he gets enough food, enough protein, he's meditating, he's making sure that his mind's in the right place. There's he's taking Alpha Brain. I don't know what he's doing, but I'm just me for
Yeah.
an
Yeah.
example.
Yeah. Yeah. Yeah.
GABA, all of these things, choline, to make sure that you are recruiting what you need to recruit too, and that you're utilizing your performance to the best of your ability. He's probably saying no to going out with his buddies at night. I mean, I don't go out
Right.
past
Right.
8 p.m. I'm like a dang
Right.
vampire, like
Right. Right.
so there's so many things that goes into this when it comes to performing at an elite level that some people don't realize too.
Yep. Yeah. No, I completely agree with that. I mean, there's so many nuances. There are so many boxes to tick. The only thing I think I would disagree with you on is the so somebody's doing everything remark, because that use of that specifically, I would say, yeah, they're doing a lot, but I would say use of the word everything implies that we as a society, as a race, know everything that there is to do in the
Mm-hmm.
first place about the human body. And you and I both know there's research coming out all the time of you got people with different what's the shit there's like, have you ever heard, damn it, what's his name, but he has some protocol that he calls like the potentiation protocol, right?
Mm-hmm.
And I used to use it in the past, but basically it's almost like if I were to just give you a quick example, it's like if you want to squat 450 pounds one day and you're slowly, you're doing your sets and you're building up, you want to unrack the bar. You don't squat it, you just unrack it at 450 and you know what I'm talking about?
I was just going to tell you this. I was going to bring this up when I was talking to him and to go ahead, keep going, and I'll tell you what I got.
Yeah. But my point in bringing that up, right, is that is something that before I heard somebody tell me that, I had no idea that was even a thing.
Mm-hmm.
And that just illustrates the fact that, Connie, there are so many things. Like, I think the baseline things to talk about, you already talked about, right? Nutrition, recovery, sleep, stress management, which is what you brought up with your dad earlier, which actually goes into allostatic load, right? And essentially what you're balancing is your allostatic load, the stressors, right? Your mental stressors, your physiological stressors, your physical stressors, and you're realizing that all of them kind of come into the same pot, and you have to balance them if you really want to perform. So ultimately what I'm saying is we can't use the word, oh, this person's doing everything, because that implies that we as a species are so advanced that we know absolutely everything that can be done, when in reality, like this potentiation thing, before I tried that my first time, I was like, oh, I didn't. When I first heard about that, I literally thought it was the silliest thing ever. And then I tried it and it worked. And I was like, interesting. I was like, there are still things to learn, right? No. So research comes out all the time. There's so many things, like this human body, right? There's so many variables. There's so many things that can change, that thankfully there are people who are very, not resourceful, but very not even novelty seeking. They're just very curious, I think is the better word to say it, right? The thing that I've recently gotten into, and you're probably aware of it when it comes to anything with a barbell, is I love velocity-based training. So these days, I'm not a big fan of percentage work, because in my mind, I'm like, RPE, rate of perceived exertion, or percentage work. Like, nah, in my mind, I'm like, screw that. How about you give me my tracker, give me my sensor, give me my iPad where I can see the data, and I will be able to tell from the data what kind of day this is from a physiological standpoint, whether I should push and whether I'm crushing it today and I should push harder, or whether I should hold back because I don't have it in the tank today. And if I were to push, I would dramatically increase my chance of injury. So I think, there's so much nuance, and encouraging people to forever be curious, instead of like, even when it comes to like weight loss, and my patients and my clients, or their sickness, and any type of kind of disorder or disease that they have. I hate that word. Oh, I've tried everything, because use of that phrase implies that you know everything to try, when you don't.
Right. No,
because I
absolutely.
don't, right? Nobody does.
No, that's a really great way to look at it. I literally told my husband, and I know this sounds funny, but I don't really care about drinking, right? But I literally haven't had a sip of alcohol in 3 years at all, because I'm like, oh, that's going to screw with my recovery. And if you track your recovery, alcohol is like a killer.
Destroys you.
It destroys your gains, right? So, but as far as reversing back to what you were talking about with potentiation, so that was another thing I was going to bring up about how strong the brain and neural recruitment actually is, because the whole time I was injured, and I get so much shit for this on my social media and stuff, because I may not squat the weight to the full capacity. I might bail out at 3/4 or a half squat, or just heavy hold it. And so my coach literally had me, I couldn't squat when I started this. I've never been able to squat over 225. And I just squatted 452 pounds at my powerlifting meet this last weekend. And we literally, the whole time I was hurt because I couldn't really squat or do anything, he would have me pick the weight up, walk it out, hold it, or not even walk it out. It might have been off the pins, right? Hold 405 or whatever weight it might be, 500, 550. Obviously the numbers got bigger and bigger, but he would have me literally just hold that weight. And then all of a sudden, when my injury was healed and I started squatting, I didn't start squatting at 225. I started squatting at 365. And within a matter of weeks, I was squatting 405. And it was all because of potentiation. My body knew, it was like, hey, we have to put more recruitment together here. This load is going to be on our back. you know,
Mhm.
your stabilizers get active. You unrack that weight, your
Mhm.
core has to be tight, your erectors are tight.
Yeah.
All of these
Yeah.
little things that you don't think of, even though you're not going through range of motion, are beginning to happen. And
Yep.
it's the same thing with like, I used to be, you know, I used to be a bodybuilder and I used to I'm a trainer, you know, and it's like you have to do perfect technique every single time. And then I learned
Yeah.
perfect technique wasn't getting me stronger. My coach was like,
Mhm.
listen, and he's a smart dude, this guy. He was like, listen, he's like, you do perfect sets and reps up until you can't.
Mhm.
And then you move the weight, even if you have to put a little English into it or a little bit of extra movement or whatever, get a little sloppy. It's okay,
Mhm.
because then the next time your brain is going to go, oh, yeah, I need to put some tissue on here. I need to recruit better.
Mhm.
I need to make this happen.
Mhm.
And it was insane the
Mhm.
differences that started happening when you started pushing the envelope just a little and teaching your body that it could go further.
Sure. Sure.
So,
Yeah,
yeah.
that's interesting. I personally, I I feel like I could learn from your coach, because I'm definitely the type of person where, you know, even that 505 squat, I could literally send you the video. It was perfect technique, right? I remember, and you know this as well as I do, Connie. Anytime you're squatting super heavy weight, you need to have so much tension even before the bar breaks the pins, right?
Mm-hmm.
You need to
Mm-hmm.
just feel so much tension
Huge.
in your body, and then you better hold that tension, otherwise you're going to fail. So
Mm-hmm.
so yeah, you know, I personally these days, and that's what I'm saying. Maybe I could learn something from your coach. I'd love to have that discussion, because me, when I start to notice, let's say we're doing a heavy sumo deadlift or a heavy conventional deadlift or a heavy back squat, if I feel like my technique is getting sloppy, that is actually where I will stop. But these days, and this is why I love numbers and the data, right? The velocity based training that I now utilize essentially will tell me, even before I start to have sloppy technique, I will watch the number. I'll watch my either eccentric mean velocity or my peak velocity. I'll watch it, or my mean velocity. I'm sorry, or I'll watch it essentially not go any higher, and then essentially get to a place where because what I do is compare. I compare my numbers. So, like, if I squat 365 today, in theory, if we're doing everything right, next time I squat 365 2 weeks from now, I should move that barbell a little faster. And if
Mm-hmm.
I'm not moving it any faster, then to me, I'm like, that's kind of a red flag that, okay, you know, that's not to say you have to stop lifting, but that means you need to reel back your expectations for the day.
Mm-hmm.
For me, what I found is that not only does that prevent me from getting sloppy, but then, you know, I genuinely believe, not just with lifting, but everywhere in life, you need to set appropriate expectations.
Mm-hmm.
And when appropriate expectations are not set, right, there's another quote, right? The root of all disappointment lies in expectation. So you know, with the numbers and the data, and actually being able to see my metrics as it pertains to, you know, inertial data, like velocity, acceleration, and other metrics, I'm able to essentially put myself in a place where I understand, okay, hey, I may not be as well recovered today as I expect to be able to lift heavy. So let me just pull back, because yeah, I think the number one thing with me, Connie, is, you know, and I didn't just start having this mindset at 40. I had this mindset at freaking 30, right? Is you want to avoid injury as much as possible. I
Mm-hmm.
believe this so strongly that I'll literally, you know, just randomly having conversations with friends or people who ask me for advice at the gym. I will straight up ask them, hey, what's your number one goal when you come to the gym? And they'll say everything under the sun, as I expect them to get stronger, to look better in a bikini, to look better naked, to grow muscle, blah 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 blah. And I'm like, no, your number one goal should be to avoid injury.
Mm-hmm.
Because if you can consistently avoid injury, then you can be doing this for 5 years, for 10 years, for 15 years, and consistently having your numbers go. Like, the only reason why I know with certainty, the only reason my numbers have just continuously gone up despite me getting older and older is because I have this steadfast focus on never getting injured. Because then
Mm-hmm.
if I never get injured, I never give my body a chance to atrophy, either from the muscular standpoint or from the neurophysiological standpoint, right? From a CNS standpoint. Because adaptation, right? When people think about adaptation, everybody thinks about positive adaptation. There can be negative adaptation too, right? And we have to do what's possible to avoid that negative adaptation. So for me, I'm like having a very strong focus on avoiding injury. I avoid injury to the extent, Connie, where people will literally talk shit to me at my gym. They'll be like, it's noon. Why isn't Nick here? And then they'll like, I have a friend who like will text me talking crap. And then I'm like, dude, I don't know what you expect from me. I looked at my recovery. I'm not coming today. Dude, it's not that heavy of a weight, blah, blah, blah. I'm like, I don't care. Like, I'm looking at the data. Like, I'm not like this. You have to try as much as possible to get your ego out of it. And I think that all too often when it comes to injury, people have so much ego when it comes to the gym, which is why we call like bro reps at the gym, right? And you know, how many times have you seen someone doing a bicep curl and they're like using their entire hips and like I'm not a fan of doing anything around ego at the gym. I really think that it leads to injury, and then, you know, it then leads to people. How many times have I heard people say, "Oh, CrossFit causes injuries," and I will literally check those people to their face, and I'll be like, "Oh, that's interesting," because I've been CrossFitting for 14 years. And I've never had an injury during CrossFit. Do you think maybe it's your ego and that you're the type of person who you will come into the gym and you'll see someone lifting what I'm lifting and you'll be like, oh, Nick has that on his bar, I'm gonna match it. You have no, you need to stop. You need to control your ego, but people are unable to do so. And I find that hilarious because I'll come across people who are stronger than me at the gym, and I'll be like, I want to, if anything, when I come across somebody who's stronger, I don't try to match their weight. I watch their technique. I will sit there and like rip apart like this whole thing we just talked about with establishing maximum tension. I will observe that. I'll be like, oh, that's interesting. Even before they unracked the bar from the weights, they took a super deep breath into their stomach, and then I don't see their stomach exhaling. It's almost like they're holding all of the air in the stomach. So these little nuances that, you know, in my mind, when I find somebody who's much stronger than me, you just have to like, don't try to match them on the weight, try to match them on the technique, you know?
Yeah, and it was interesting because I've spent a lot of time injured, obviously some of it not from the gym, but this last prep, so I switched coaches when I got injured, and because I had on good authority this guy would fix me, which he did. And the funny thing is that this is, everybody's like, oh, well, you're not screwed up. Like, what's going, like, usually by the time you hit a powerlifting meet, you've got all sorts of things going on. And I felt like $1 million. I came into the meet injury free. I felt good. Not the next day. Sunday, I was a little bit tired, but you know, by Monday, I was $1 million. Right. And that speaks a lot to the way that we trained. And so sometimes when it sucks because you have to pull back, like the last couple weeks of prep, I literally did a couple of things that were like, it was like not what you would anticipate to be in a peaking phase, right? He's like, oh, well, you're tired today, so you're going to do 3 sets of 3 with 30-second rests at 60% of your max. Oh, well, wait a minute. We're trying to peak out for strength here. No, we're going to work recruitment today because your body's tired. You know, it was like you had to adjust on the fly. There was no program per se. The program was working with what your body had to give you that day. And that was one thing that I really learned was such a huge game changer with everything in the last year. So yeah, anyway, well, we dove into a whole bunch of fun of that stuff, but you know, because we got in a rabbit hole, we forgot to talk about you. So who are you and what do you do?
Yeah, no worries. So my name is Dr. Nick. Dr. Nwabueze, which is ever since med school and having patients murder and destroy that last name. And I mean, they tried so much, but they basically tried to pronounce it for so long that I remember telling some patients, I was like, in my head, I was like, this is a waste of time. Like, I'm here to talk about your disease and how we're gonna fix it, and when we're over, and you want to focus on my name, like, so then I was just like, you know what, just call me Dr. Nick. Like, screw my last name. You don't need to say it. So yeah, so my name's Dr. Nick. I am a primary care physician. I've been practicing medicine now ever since. So graduated med school in 2015, but as most people know, you start to see patients in a lot of med schools since from day one. So for me, that was 2011. So, um, but in terms of since graduation, I've been practicing medicine since 2015. And yeah, I'm a primary care physician. I very much believe in um, some very core tenets, and I have certain ideologies that I think, from what I've noticed, many other doctors don't necessarily ascribe to or believe in themselves, and I think that is what has caused my appeal on social media and kind of so many people to resonate with my message. Kind of if I were to just kind of repeat the core things I believe, right? It's movement is medicine, is kind of the primary one. I truly believe that prevention is better than cure, and that we should not simply medicate everything. In fact, medication and pills should not be the first solution for anything. There should be any number of lifestyle modifications and interventions recommended to patients and made within patients, because obviously I can't, as your doctor, I can't make the changes for you. You have to make the changes. But if you don't even know that those changes have any degree of efficacy, if you don't know that those changes are even, it's like what we were talking about earlier. If you don't know that something is even an option, right? It's something that you could even endeavor to do, you're not going to do it. So, yeah, I think that, with my patients and with my clients these days, that's something that I definitely encourage. So yeah, that's a little bit about me. I practice medicine. The thing that I'm most passionate about these days, though, is kind of distributing education. A lot of it for free on my Instagram, through content, through reels, through videos. For example, I just over the last week, I had content on how to improve your testosterone. I had content on how to address your sugar addiction. I had content on people with high cortisol and symptoms of high cortisol, and how to fix that. So I just, try to continuously release new content and education for people. Very recently, I started a community, a very cheap community of people who essentially all believe the things that I believe, have the ideologies that I have as it pertains to movement being medicine, as it pertains to prevention being better, or being superior to cure, and that should hopefully be the mindset that everyone operates from. And the community it's very small right now, and it's growing. I literally just started it, but I'm just excited that there are other people who think like me, and that we could, through the community that I put together, that I can release full courses on fixing your testosterone, full courses on improving your cortisol, full courses on improving your sleep. Right, so many people have sleep issues in this country, and
Mm-hmm.
we got doctors prescribing Ambien. Here's a good example. Why is it that we have so many doctors prescribing Ambien when something called CBTI, cognitive behavioral therapy for insomnia, is now the number one recommended modality for treating both sleep onset insomnia and sleep maintenance insomnia. So and so many doctors are not aware of this, right? So if a patient comes in, they'll say, "Hey, take this Ambien." Well, if you look at Ambien and all these other meds, some people will think, "Oh, this is helping me sleep." That isn't so. Sleep and sedation are two different things.
Things.
You are being sedated. You're like a horse. If you want to call that sleep, you can call that sleep. That's not sleep. And that explains why you feel groggy, and you don't feel restored, and you feel cognitively slow, and you have all these kind of secondary issues that poor sleep causes, which a primary one is weight gain, because lack of sleep and lack of recovery causes a certain degree of insulin resistance, and then it can cause all types of issues that lead to weight gain. So yeah, I think that I realize now as I talk, I've gone way beyond telling you who I am, but yeah, that's just a
No,
little bit about me.
this is excellent. And you said something that's key here, and it's an ounce of prevention, right? And I'm very impressed with what you're doing, and happy with what you're doing, because things have started to lean a little bit, I feel like, more towards the prevention side in the medical system, which is promising, because you're kind of in this place where I'm sure you see it with other providers. The education isn't there, I feel like, for them as far as the
Agreed.
preventative stuff. So
Sure.
it's tough because you see a lot of providers that may not be making the best choices for their patients, but it's really not their fault in a multitude of different ways, right? The education for prevention's not there. They're more or less educated in the treatment of symptoms, not the prevention in the first place. So, that's where I love where you're getting into the insulin resistance and you're getting into that. I know it's funny because as a coach, I have a multitude of doctors that are my clients, and we
Yeah.
start going through lab work. I'm like, well, let's do lab work. And they're like, well, I've done my lab work. And I'm like, well, let me give you my list,
Yeah.
and I
Yeah.
give them a
Yeah.
list, and we start going over things, and they're like, wow, I could totally do this with my patients. And this makes complete sense. And hearing all
Wait,
these
tell me your
things.
list, Connie. Tell me your list. I want to hear.
Okay, so a full you're gonna test me here a day after a powerlifting meet, but a full
Oh, no, no,
CBC,
no.
full
Okay.
CBC, full CMP, lipid
Good.
panel, right?
Good. Yeah.
Homocysteine,
Yeah.
CRP, fasting insulin, full, A1C, fasting blood glucose, although I don't feel those are the most important. I think fasting insulin is the most important. Free and
Agreed.
total testosterone, FSH, LH, estrogen, estradiol, progesterone, ferritin, all thyroid hormones. So TSH, free T3, free T4, reverse T3. Did I say CRP? I think I did.
You did. You did.
Homocysteine, and I think ApoB is also a really important one that is not
Sure.
getting looked at. And those are pretty much
Sure.
the realm of one. A DHEA, cortisol. I think that's most everything
Those
off.
are all the those are all the ones on my list, except for you touch on a lot of like the FSH, luteinizing hormone, LH. I wouldn't order those me at a baseline for everybody, but those are really, and I totally agree with what you said about fasting insulin. In fact, you probably know this, Connie, but 88%, literally, you put 10 Americans in a room, 9 out of 10 people have metabolic dysfunction, have insulin resistance, right?
Mhm.
And the problem with medicine these days is we're checking fasting glucose. And the other day, one of my clients, he's not a patient, he's a client of mine in my community. He showed me his fasting glucose, and it was 99 milligrams per deciliter. Then I asked him, "Oh, what did your doctor say?" And then he was like, "Oh yeah, my doctor said that's fine." And I was like, "What? Your,
No.
your doctor said that was fine?" Like, this is the crap that pisses me off. I'm sorry. Like,
Well, and
yeah.
so
So
as I explain to people, as your blood glucose is going to be fine as long as your pancreas is working. It's when
yeah.
the pancreas starts to get tired and it's like, hey,
Yep.
yo, I'm not doing this anymore, that you start having all these
Mhm.
other problems. And a lot of the cholesterol problems this country is having is due to insulin resistance. And we know that. And
Mhm.
they're like, why? I'm
Mhm.
like, well, okay, if your system can't clear blood glucose, what's it got to do? It's got to turn that into
Sure.
something. You're storing fat
Sure.
like crazy. And so
Yep.
it's no wonder we're in this obesity epidemic, which you and I both
Right.
know all about that.
Sure.
But,
Yep.
it's so important to test fasting insulin. Same thing goes for thyroid. How many providers do you see? They see high TSH. They're like, here's some levothyroxine. They're not
Mhm.
seeing, I mean, maybe that person's free T4 is fine. And then we just gave
Mhm.
them levothyroxine. What if they're not
Mhm.
converting it to actually use it due to their digestive problems, due to their insulin
Sure.
resistance, due to the amount of
Sure.
stress that they're in, and reverse T3? There's so many more things that need to be looked at. And it's not my
Mhm.
job as a coach to treat them. It's my job as a coach to be like, let me educate you on this so that you can go to your
Mhm.
health practitioner and have a better understanding of how your body works, not only so that you can have an educated talk with your medical provider, but also so that you know what life factors are affecting these things and you can make improvements in those areas that hopefully impact your numbers in a positive manner.
I'll tell you what, Connie, you are motivating me to. I need to make this. I need to. I already have a document that I give that the people in my community have access to, a document that I've made. Just like you just mentioned all these labs, I have a document where I have all these different labs that I recommend for my clients. But more importantly, I have what I recommend that they should result at, right? What
Mhm.
value they should be at. However, as we speak, I realize that's just a document. I could literally make a video course for people in my community, demonstrating, hey, these are where you want these are the labs that we're going to look at. These are the labs you need to trend over time, right? Because here's the thing, you and I both know it doesn't matter where the lab is now. What matters is, where is it over time? Is it trending? Yeah, where is it going down? Is it going up? Is it trending in a good way or a bad way? So yeah, I could easily make content all on this and educate, people in my community and empower them. And yeah, I think it's even the document that I just mentioned that I have, one of my issues with the way we're going, or the way things are going right now in medicine, is that we are comparing a lot of lab values to normal. And so for example, right, that 99 milligrams per deciliter glucose, that fasted glucose that one of my clients has, if you look at the lab values from Quest, from LabCorp, from any big lab facility, they absolutely will say, yeah, 99 milligrams per deciliter is normal. The problem, wait, do you have one there?
Yeah, I was gonna see what it was. I don't even look at the current ranges unless I'm on a freaking tangent. It says 99's okay.
Yeah, and it says reference range, right? Is that what you see? It's there. Yeah, it should. So the problem with this reference range that I like to try to, most people don't understand this, is they're literally comparing you to every other American now.
Yeah,
right.
That's sick.
And that's a thank you. That's a huge problem. If you keep in mind that 9 out of 10 Americans have metabolic dysfunction, 9 out of 10 Americans have some degree of insulin resistance. So many people are sick. We live in an obesogenic society that is literally poisoning people, unless you as a citizen have taken it upon yourself to find people like me, anybody else who's educating people, to find courses and classes and education and learn for yourself, and then reject, because no one's forcing me to go to freaking Walmart and buy Oreos and eat that every day. You can't force me to eat that crap, right? No. So nobody's forcing you to get sick. Your lack of education is making you sick. So if you consider that, and we back up and we consider, okay, if you accept the fact that your doctor tells you, hey, you're fasting glucose of 99 milligrams per deciliter is normal. If you just accept that and don't step back and think about, what does that mean? Normal means compared to everybody else. If you're going to compare yourself to a population that is sick, then you quickly start to realize that there is a difference between normal and optimal. Optimal is where you want to be. Optimal is you becoming the fittest and healthiest version of yourself. So literally, the document that I prepared for my clients, for my community, for the people in my community, it doesn't say, hey, a fasting insulin under what's the normal limit now? I think like under 10 is normal. No, it straight up, for me, the number that I like to look for fasting insulin, for example, is 3. I want mine under 3. The number for glucose that I like to look at for fasting glucose is 82. For both, and actually there's also a difference too between, so in the document I provide for my community members, I both list out for men and for women, because there are different numbers. From a biological standpoint, we're not even hormones, right? FSH, LH, testosterone, like we talked about, our numbers are going to be different. So I think that it's up to every single person to empower themselves to say, hey, I am going to, even if my doctor's saying, oh, you're within normal limits, sometimes, and I don't think any of these doctors are doing this from a malicious standpoint. No. You hit the nail on the head earlier, that a lot of these doctors themselves are not only are they ignorant, because it is like nutrition stuff is taught in the most cursory manner in medical school, most cursory manner, like 4 hours of nutrition talk, right? Everything that I know that I teach my clients, that I teach my patients, I taught myself. So, and I think that's absolutely, it's within, I mean, I'm sorry, but to go through medical school, the amount of different skills that you need, it isn't just intelligence, right? You need resourcefulness, you need a certain amount of grit, you need obviously intelligence, but all of these different skills that you have speak to an ability in you to learn even things that you weren't taught. You have an ability to go out there and find the relevant information to sift through all the crap, destroy anything that's noise, anything that isn't actually backed up by data and studies and research. You can just discard as a physician, and you can kind of focus in on the things that are important. So this is why I don't accept the excuse from any doctor like, well, I can't teach my patients that. I didn't learn that in med school. I don't care. You're a doctor. Like, you should have enough intelligence and resourcefulness and grit and all the other characteristics to find the relevant information from a reputable source, learn it, ask the right questions, get the right answers, internalize the right information, and then synthesize that information amongst the larger body of knowledge that your brain holds, right?
Mm-hmm.
So, whether we're talking nutrition or anything else, I think that it's very important to, you as a person, right? Anybody who's listening to this podcast, it's very important to sit back and question your doctor sometimes. And hey, Connie, your 99 milligrams per deciliter fasting glucose is normal. Then you should ask, okay, what is normal? Define that. What does that
Mm-hmm.
mean? And then if they know enough, they're going to be able to tell you, oh yeah, amongst the population. And then if you know enough, you're going to be like, okay, well, that's not where you want to be, because you don't want to be normal within a sick population, because then you're just going to be sick. That doesn't make any sense.
Right.
So
Well, and I'll
I feel
take
like
that.
go
No,
ahead.
I will take it one step further, because the other thing is that how many people do you know that are in their peak health are going into the doctor and even getting their labs done? They're not. I mean, some people are, because
Yeah.
they're like us, and they're like,
Yeah.
oh, like, for example, I ran right straight down to the lab and did my lab
Yeah.
work the day
Yeah.
after my powerlifting meet, because I wanted to see what my metabolic panel looked like. I was like, what's my kidneys look
Yeah.
like today? What's my liver
Yeah.
look like today? I
Yeah.
was
Yeah.
I was like, science experiment time,
Yeah.
but
Your
like,
creatinine is
yeah.
you have acute kidney injury.
Yeah. And so I'm like, I want to see this, right? But I just effed up
Sure.
everybody else's within normal ranges when I did that.
Sure.
But part of
Sure.
that is like, how many people, unless there's somebody that's into the things that we're doing, if they're healthy, are even going in and getting their lab work done? Most of them aren't, I can tell you that.
Yeah.
And so we have
Well,
further skewed those numbers that they are saying is okay to be at.
oh, hell, I didn't even think of that. That's a really good point. Yeah,
Mm-hmm.
that's a really good point. So yeah, we're skewing the numbers towards even essentially a greater percentage of the population being sick, because
Yes.
the healthy people aren't checking there. Yeah, yeah.
Yeah.
No, you're totally right. You're totally
Correct.
right.
And I
And
mean,
and what oh, go ahead.
no, you're good.
No, what you said earlier about the glucose, and essentially, obviously your pancreas, being what you should look at. The reason why I agree with that, and I think kind of a more succinct and concise way to put it in the future for people, Connie, is lagging indicators versus leading indicators. Your fasting glucose is a lagging indicator of the health of your pancreas. So much so that most people who are diagnosed with diabetes, if they've been going into I'm sorry, I said that wrong. And I know some people are going to be nitpicky about this. So obviously there's a couple different forms of diabetes. So I'll clarify that statement. Most people who are diagnosed with type 2 diabetes, if they have been going into their doctor yearly for the last 10 years, and you were to look at all of their labs from the last 10 years, it would not be shocking to you, just looking at their numbers, that they're diagnosed with type 2 diabetes eventually. Because a lot of times people will be diagnosed with type 2 diabetes and be like, this came from nowhere. No, it didn't. It was there the entire time. The problem is you were looking at a lagging indicator, the fasting glucose. You should have been looking at a leading indicator, the fasting insulin. Because fasting insulin 10 years ago would have told you, hey, you need to do something. There's something going on in your body. You need to fix this. However, you ignored fasting insulin for 10 years ago, or, to your credit, maybe it wasn't you that ignored it. Maybe it was your doctor who ignored the importance of, because a lot of doctors will not do that. Well, we all have our standard set of labs. It's not like we all do the exact same thing. But for me, yeah, there are labs that, not just I like to order, but that there are labs that I like to encourage my patients to order. I'm sorry, I like to encourage my clients to order from their doctors. I mean, there are just labs that need to be done and that need to be tracked, and most people are not being aware of it, and this is why I think podcasts like this are super important. Because listen, in as much as in as much as I think we live in a very victim mentality biased society where
Mm-hmm.
people like to sit here and go, oh, my doctor didn't do this, my doctor didn't do this. I'm of the opinion, and this is how I treat, I'm not just saying this like, oh, people should do this. This is how I live my life.
Mm-hmm.
Anything that's a screw up is my fault. It is not anybody else's fault. It is my fault. Why is it my fault? It's
Mm-hmm.
my fault because if I can assign blame to me for something, then I also give myself power to fix that same thing.
Right.
If I say, nope, it's Connie's fault, I'm literally, what I'm inherently saying is, there's nothing I can do about this situation. I cannot rectify it. I cannot fix it. Only Connie can fix it. And
Mm-hmm.
why would I want to give you that amount of power over me instead of just accepting responsibility and then making the changes necessary? And the
Mm-hmm.
reason why I bring this up is simply to say that if somebody ever feels like, oh, something is their doctor's fault, you have to keep in mind that doctors, we go to med school, we take the Hippocratic Oath, we take our job seriously. But in reality, nobody can or should care about your health more than you do.
Mm-hmm.
Nobody, including your doctor, including your mom, including your dad, including your kids. Nobody should care about your health more than you do. So you can sit here and you can try to blame somebody for not doing the right labs, blah, blah, blah. Or you could take it upon yourself to self-educate, to listen to podcasts like this, to listen to other podcasts with, the myriad of other physicians and doctors who show up on podcast episodes and just share free knowledge, or show up on Instagram and share free knowledge, right?
Mm-hmm.
And yeah, yes, we all have 24 hours in a day. But then maybe that means that you should take away some of that 24 hours from watching mindless TV and mindless entertainment, and give
Mm-hmm.
more of that time towards educating yourself and empowering yourself. So yeah.
Absolutely. I love that. I mean, I think we're headed in the right direction with some of these things. It can be definitely difficult in these times, especially with so much propaganda towards not healthy things, for sure.
Sure.
And that's
Sure.
where I really encourage people to look more into like a more of a functional, which I hate that saying even now because of the way it's gone, but
Mhm.
find somebody that is more in the preventative space, somebody that can help
Mhm.
you look at things from not an emergency standpoint, but let's not get to the emergency standpoint. Let's look both ways before we
Mhm.
cross the road instead of just crossing the
Mhm.
road, So,
Yeah, and even with that, yes, I totally agree. I find someone in a preventative space, but I also believe in finding somebody who um, endeavors towards the same activities that you do, right? And
mhm,
has a lifestyle that's relatively aligned with yours. That's not to say that if I were looking for a doctor, they have to CrossFit. No,
mhm,
I just want you to be active and do something. I don't care if it's mountain biking, if it's rock climbing, if it's powerlifting, just something that you're. I don't want you to be the lazy doctor who I come into, and like I come into the office and you're 200 pounds overweight, you're busting out of your belt, and you're sitting there and you're trying to tell me, hey, your cholesterol is high, you should either take this pill or you should eat less and move more. Like, you're a hypocrite. Look at you. Like,
right.
why would I want to listen to you? And there has been some research that actually suggests that doctors who are more unhealthy and they themselves do not endeavor to optimize their lifestyle, those are actually the doctors who are less likely. They're not more likely to recommend lifestyle change to you. They are less likely. Why? Because all of us as human beings, in whatever capacity, whatever field, whatever, like, none of us want to be viewed as a hypocrite. That's just natural with human beings. So
Hmm.
if you don't want to be viewed as a hypocrite, as a physician who is not doing the very lifestyle things that you're encouraging, you simply won't make those recommendations. You
Hmm.
simply will shut your mouth and not say things. Even if they come up in your head, you'll just say, hey, take this pill. So I think that absolutely it's very important to try to find doctors who are, into the functional side of things, into the prevention is better than cure side of things. But I think trying to find a doctor who is also aligned from a lifestyle standpoint, aligned from a mindset and an ideological standpoint, and a
Hmm.
value-based standpoint. And yeah, I'm not gonna sit here and lie to you and tell you that that's easy. That it's almost like dating, right? And finding your person
Hmm.
and going through all the garbage. And yeah, but if you want to find a doctor who you will entrust a degree of your health to, because like I said earlier, your health is ultimately your responsibility. But if you want to find a doctor who you entrust a degree of your health to, then you need to sift through all the garbage, because just like anywhere, doctors are simply a microcosm of society. There's a bunch of garbage, there's a bunch of people with garbage mindsets in society. There are a bunch of doctors with garbage mindsets as well. I remember in med school, the first time I saw a doctor near the hospital smoking a cig outside, I like did a double take. I was like, wait, what? I didn't say anything to him, but in my mind, I'm like, wait, so you're telling me with everything we know, with all the studied, with the 16 to 18-hour study days that we have to undertake, and we know everything about how cigarette smoke affects us negatively, and you're gonna choose to light that cigarette up and put it in your mouth? Like, I don't understand that. I don't. You know all the knowledge and all the education, and you still choose the poor choice. I don't understand. It makes no sense to me.
Yep.
So
I love that. Well, I mean, I think we definitely have to do this again and dive more into the other realm of
Sure.
things. I've kept you for so long today, but this has been
Sure.
an excellent time. I have enjoyed every second
Absolutely.
of it. Such great conversations. If people want to find you, how do they go about doing that, Nick?
I think, to be honest, probably the easiest way is my website that I can give everybody.
Mhm.
And in fact, so what we were talking about earlier, in terms of education. So I have, my community, which the website's a little bit longer, and I don't think I could easily give it out here. But what I would encourage people to do is that I have a free nutrition class. It's a nutrition fundamentals class
Mhm.
that kind of has 9 different video lessons, me breaking down everything from carbohydrates to fats to proteins to fiber to fructose to water to just 9 different lessons across everything that you need to know that's fundamental about nutrition, and it's completely free. And would absolutely love for people to educate themselves, right, and
Mhm.
learn about these things, because I'll tell you what, these 5 or 10 minute appointments with your doctor in their doctor's office, they're not going to have in 5 to 10 minutes. They're not going to have enough time to educate you on the things that move the needle most. In my mind, there are many things that move the needle, but in my mind, the thing that moves the needle most is nutrition, because you
Mhm.
have to eat every day. You have to eat. So you're either every bite that you take, you're either poisoning yourself with every bite, or you are building yourself, and you are sustaining yourself, and you're revitalizing yourself with every bite that you put in your mouth every
Mhm.
day. So
Mhm.
the biggest needle mover in my mind, like I said, is nutrition. Obviously sleep, obviously recovery, obviously the gym.
Mhm.
So many things also move the needle, but nutrition is a fundamental thing. So, that's why I released the nutrition master, or the nutrition fundamentals master class, and would love for you guys to check that out. So you can get that at my website. So my website is www.thefittest TheFittestWou.org, www.thefittestestu.org. And on social media, my Instagram name is thefittestdoc.com. And I'm sorry, not .com, but just the fittest doc. And
Mhm.
I'm also on other social medias, right? I will admit I don't post as much on, like, I don't know, TikTok, Facebook, YouTube.
Yeah.
I don't post as much. I'm definitely much more active on Instagram, but across all the social medias, my Instagram name is the fittest doc. And hopefully now everybody who has listened to this podcast understands why, can understand where that name came from. I'm a very big believer that every single one of us should be on a daily basis aspiring and making the decisions necessary towards the fittest version of yourself, right? So
Mhm.
obviously, me as a doctor, my goal is to become the fittest doc, to become the fittest version of myself. um, so yeah, gave you my website, gave you my socials, and
Yeah.
would love for you guys to check it out.
Yeah, and I'll put
And
all
then
that in the
yes, to
show
to
notes
to to,
too.
to back up your conversation, or to back up your statement earlier, I completely agree. Yeah, I've loved this conversation, and the way we started it out, and the fact that you dominated, your challenge in the past, or your challenge that you recently had to surmount, right, with your
Mhm.
brachial plexus injury, and coming back from that and coming back stronger. So I'd
Yeah.
love to hear it.
Well, I really appreciate you too. And I'm going to stick all of your information in the notes. I'll have you send me a nice list so that everybody can access it
Sure.
easily. And I hope they go
Sure.
and find you because you're doing awesome things.
Thank you. Thank you. I'm trying. And yeah, I'll come back on in the future, but this ending point is definitely perfect because I need to go to the gym like right
Yeah.
now. So,
Awesome. Thank you
yeah,
so, so much.
awesome.